Good afternoon. So as the governor mentioned, we are thinking very intentionally about the COVID-19 vaccine, and I know there will be a lot of concern about the safety of this vaccine. There is a rigorous process that is in development and part of the approval process for the vaccine. There are multiple clinical trial phases to ensure both safety and efficacy. Clinical trials have gone faster, but important safety steps have not been skipped. The entire world is focused on a safe vaccine, and all needed resources have been devoted to its development. Additionally, an independent institutional review board consisting of clinicians, scientists, and community members review the development and the study of the vaccine. Once a safe and effective vaccine is available, CDC planning assumptions indicate that 80% of the population would need to be immunized to achieve this herd immunity. That's when we think a sufficient proportion of the population would be immune to this disease, which would then make spread very unlikely. The vaccine will not be mandated, but we will work to provide all the relevant information about vaccines in general, about the importance of vaccines, about this vaccine, and talk about the testing and approval process. Right now, the Illinois mass vaccination plan for the COVID-19 vaccine will build off of our established VFC, or Vaccines for Children program, as the governor mentioned. As the governor also mentioned, various providers, initially the local health departments, but then hospitals and other providers will register with iCare and order the vaccine through the state. We will coordinate the delivery of the vaccine, which will go straight to the providers, and we will oversee to ensure equity across the state. Vaccinations, once they arrive, will take many, many months at the minimum to actually get into the arms of the people of Illinois. And so this will unfold in phases, with initially only a small amount of vaccine available, and as production ramps up, more individuals will be able to avail themselves of this countermeasure. There will not be a cost to individuals for the vaccine, although providers may charge a small fee to administer the vaccine, which will go towards insurance for those who have insurance. But no one will be turned away from getting a vaccine due to any inability to pay. While we continue to fine-tune these vaccination plans, it's important that we continue to do the things that we do have at our disposal right now. Again, of course, the masks, the washing of our hands, and the maintaining of distance. We are continuing to see increased cases, increased hospitalizations, and increased deaths, and we have to all take our role and personal responsibility in helping turn this around. Since yesterday, most regrettably, we've lost another 69 individuals for a total of 9,345 deaths. Today, we are reporting 4,342 new cases for a total of 355,217 total cases since the beginning of this pandemic. 2,338 individuals were reported to be in the hospital overnight with COVID-19, and of those, 502 patients were in the ICU and 194 patients were on ventilators. In the last 24 hours, 66,791 tests were reported for a total of almost 7 million tests since the beginning of this pandemic. While you may be tired of hearing it, the virus is not tired, so I'll continue to say it. Wear your mask, wash your hands, watch your distance, and also get your flu shot. So in other words, mask up, wash up, back up, and sleeve up for your flu shot. Thank you. And now for the comments in Spanish.